Good afternoon, dear students. Yesterday we have discussed about the sports participation of women in India and in other countries, and why the less participation of women in India. Move on to the next topic. Next topic is special consideration, Minarc, menstruation and dysfunction. Menarc, menstruation, dysfunction. As a matter of fact, the female participation in the field of games and sports has shown remarkable increase during the yester decades. This change has been noticed not only in India but across the world. But on the other hand, a large part of the population still has an opinion that sports and games are not directly linked to women. Women are not expected to be muscular, robust, aggressive, and dominant. Many people opinion that women have different anatomical and physiological structures and capacities which are not suitable for sports activities. They even say that participation in sports lead to various problems during menarche, menstruation, pregnancy, and menopause. In order to evade this misconception and myth, let us study about the relationship of these biological process and women participation in sports. First is menarche. Menarche is the first period or first menstruational bleeding that a young girl has. Menarche usually occurs approximately at the age of 12. However, it can happen as early as during 8 to 9 years of age or as later as during 16 years of age. Women's reproductive system is complex and sensitive. It's complex and sensitive to physiological stress. Such type of stress is usually associated with conditions like delayed menarche, amenorrhea, etc. These problems are experienced by some women who are engaged in intensive sports activities. However, women with delayed menarche may succeed in sports such as gymnastics. Those women who have early menarche may have an advantage in sports such as swimming and rowing because they get more adipose tissue or adequate weight. So this is all about menarche. Now, menstruational dysfunction. Menstrual dysfunction is a disorder or irregularity in women's menstruational cycle. In other words, it can be defined as an abnormal bleeding during the menstruational cycle. Normal menstruational cycle varies from 21 to 35 days. Its flow lasts approximately 2 to 7 days. Menstruational irregularities seems to be higher in women. and women athletes in comparison to non-athlete women. So, you know what is Minarc? It's the first menstruational bleeding in young girls at the approximately age is 12, but it is early as 8 to 9 and as late as 16. So, and menstruation dysfunction means irregular bleeding, irregular menstruational cycle. And generally we have girls are having a cycle of 21 to 35 days, and if their bleeding are less than this in this period or more than in this period, so it will be called menstrual dysfunction. Menstruation and sports participation. Earlier, most of the people used to believe that participation in sports during menstruation could be physiologically harmful. Recent studies conducted in the field shows that there has been no basis or evidence of dysmenorrhea, painful menstruation, of any consequences as a result of intensive participation in sports. If a girl is having problem of dysmenorrhea, that means painful menstruation, they are having pain during menstruation, but if that particular girl are involved in sports activities, intensive participation in sports, they may have reduced this pain, and they may have no pain during menstruation. So it is not like that menstruation is inherent or it's restrict our activities. No, if you are doing in that stage, in that period, if you are doing physical activities, it will be beneficial. It reduces menstruation pain. So it is totally a misconception. In fact, there has been recent report to indicate complete absence of menstruation in women who usually get trained for long duration in running. However, it is not applicable for all the women sportsperson or in all the sports. Some studies indicate that sports participation is beneficial in relieving pain and preventing dysmenorrhea. Even research studies show that a small number of women participating in sports experience by dysmenorrhea in comparison to non-participants. Some studies also indicates that there is no specific effect on sports performance during all phases of menstrual cycle, because international record have been set in all the stages of menstrual cycle. So it is not true that a woman is having menstruation at the time of competition, it will affect the competition, it will affect the performance of a woman at that period. No, it is not true. It will not affect in any sense on the performance, on the participation in competition. So according to the studies, it is clearly mentioned that there is no effect on the performance of the women athlete during menstruational cycle. Research studies also shows that women's strength decreases at few days prior to menstruation and continue to remain at slightly lower level throughout the menstruation period. research can be shows that the strength of the women decreases at the time at the prior of the menstruation, few days prior to the menstruation, and it will continue to remain at slightly lower level throughout the menstruation period. Basically, the menstruation period lasts from 3 to 7 days. So, you can say that the decrease in strength, if we can take an example of studies, researches, so it will last up to up to 10 days if we are taking few days prior to the menstruation, and it will continue till the whole period. In conclusion, it can be said that there is no impediment or barrier to a sportswoman to engage even in competitive sports on any day of the month. Menstruation is not a problem in the way of achieving top sports performance. It is not a problem, it is a part of our reproduction. So, women athlete or women's don't take as a disease, don't take it as a problem. It is a important part of our reproductive system. So this is all about special consideration, Minarc and menstrual dysfunction. Now, female athletic threat. There are main three female athletic threats. First is osteoporosis, second is amenorrhea, and third one is eating disorders. Female athletic threats is a syndrome in which osteoporosis, amenorrhea, and eating disorders are included. It is simply known as thread. The thread is a serious disorder or illness with lifelong health consequences and can be fatal. In fact, it is a syndrome of three interrelated conditions. Interrelated means these osteoporosis, amenorrhea, and eating disorders are interrelated. That means if someone is having osteoporosis, so they may lead to amenorrhea and eating disorder. If somebody is having amenorrhea, they may have a chance of having osteoporosis or eating disorder. So, if a women athlete is suffering from any one condition of the thread, it is likely that she may also be suffering from the other two conditions of the threads that I have already explained you, that if a person is having any one thread out of these three, so that means they may have a chance to suffer by these other two also. As a matter of fact, sports and physical exercises are part of balanced and healthy lifestyle. It is observed that the individuals who indulge in sports activities are healthy, alert, physically fit, and are less likely to experience depression. Some women who take part in sports activities intensely may be at risk of female athletic threats. A woman athlete may show one, two, or all the three conditions of the threats. With the increase in women participation in sports, the chances of women athletic thread are also enhanced. Now we are talking about the symptoms of the threats, female athletic threats. The symptoms of threats may include fatigue, frequent injuries, loss of endurance and power, irritability, increased healing time for injuries, enhanced chances of fracture, secretion of menstruation, low self-esteem, etc. So these all are the symptoms of female athletic threats. The gravity of these symptoms may vary. Along with this, the occurrence of these symptoms depend upon the condition of threats. First, we are talking about osteoporosis. Osteoporosis refer to decreased bone mineral density. It is a skeletal disorder. A reduction in bone mass may cause fracture. So osteoporosis is a skeletal disorder, and in osteoporosis, bone mineral density will decrease. In fact, low estrogen level and poor nutrition, especially low calcium intake, can lead to osteoporosis. It is one of the significant threat of female athlete. As a matter of fact, healthy athletes tend to have higher bone mineral density than their non-athlete counterparts. As physical and weight-bearing exercises have beneficial effect on bone density in women. But in case of osteoporosis, weakening of bones occur due to the loss of bone density and improper bone function. That means if women are not actively participated in sports and healthy lifestyle, they may have weak bones, they may have less bone density, so they in comparison to non-athlete. So it can be said that the exercise is very important. But in case of osteoporosis, weakening of bones occur due to loss of bone density and improper bone formation. Osteoporosis may occur due to loss of bone density and improper bone formation. This condition may be deleterious to athlete as it may lead to stress, fracture and other injuries. If your bones become weak, your bone mineral density become weak, decrease. So if you are simply just fall from the stairs, or you will just fall from some less distance, but you may have fracture because your bones are not strong enough. So the women, osteoporosis mainly occurs in women because when the menstrual cycle, when there are abnormality in menstrual cycle, so the estrogen is a hormone that releases calcium, and that is good for bones, and it will increase the bone density. But those women who are having abnormal menstruation, their estrogen releases less, and estrogen is observed by the bones, and that's why women are having osteoporosis. Then this condition may be deleteriously to athlete as it may lead to stress, fracture, and other injuries. Indeed, there are various factors which usually lead to osteoporosis among women athletes. First is insufficient calcium in diet. The main cause of osteoporosis is insufficient intake of calcium in diet. In fact, 100 gram calcium should be included in daily diet by women athlete. In addition to calcium, vitamin D should also be included because it is essential for absorbing calcium in our body. Vitamin D absorbs the calcium in our body. So, if the women are having insufficient calcium diet, they may have osteoporosis. Second reason is amenorrhea. Women suffering from menstrual dysfunction or amenorrhea for more than 6 months are likely to face osteoporosis because the secretion of hormone called estrogen is decreased in the condition. That I have already explained you that the secretion of the estrogen hormone is less in condition of abnormal menstruation or amenorrhea. This hormone is necessary for the absorption of calcium in the body. Because of this hormone, the calcium will be absorbed in our body. If calcium is not absorbed in our body, there will be a less amount of calcium in our body, which may lead to osteoporosis. So, second reason is amenorrhea. And third reason is eating disorders. Eating disorders like anorexia and bulimia nervosa may also cause osteoporosis because the calcium intake may be less or insufficient. In fact, not getting sufficient amount of calcium can also have a lasting effect on how strong a woman's bones are in the later part of life. So, eating disorders may also lead to osteoporosis among women athletes. Now this is all about, we have discussed about osteoporosis. Now, amenorrhea. Amenorrhea is a menstrual disorder or illness in women where girls of 18 years and above either never begin menstruation or there is an absence of menstruation. I repeat, amenorrhea is a menstrual disorder or illness in women where girls of 18 years and above either never begin menstruation or there is an absence of menstruation for 3 months or more than that. With the history of normal menstrual cycle, amenorrhea menstruation is absence of menstruation from 3 or more than 3. So it may lead to amenorrhea. Amenorrhea can also be defined as a secretion of women's menstruation cycle for more than 3 months or more. Now, types of amenorrhea. There are 2 types of amenorrhea: primary amenorrhea and secondary amenorrhea. In primary amenorrhea, it is characterized by delayed menarche, which is the onset of first period during puberty. That means first stage is less to less 8 to 9. If and up to 12, and last to last it will up to 16. If after there is no menstruation in a female at the age of 16 or after that, that is called amenorrhea, primary amenorrhea. So the primary amenorrhea is delayed menarche, which is the onset of first period during puberty. And secondary amenorrhea is a woman who has her natural menstruation cycle at specific time and then stops menstruating for 3 months or more than that. He is said to have secondary amenorrhea. So I think you will understand the difference between secondary and primary amenorrhea. In primary, they are delayed in the first menarche, delayed in menarche at the age of puberty. That is primary amenorrhea. And secondary amenorrhea means absence of menstruation cycle by 3 or more than 3 months. This is a difference between primary and secondary amenorrhea. There are various factors which may inspire or enhance the chances of amenorrhea. First is hormonal changes. Some hormonal changes, such as change in the output of gonadotropic hormone, may lead to amenorrhea. In fact, the gonadotropic hormone stimulates the growth of gonads and secretion of sex hormones. So what is gonadotropic hormone? Gonadotropic hormone stimulates the growth of gonads and secretion of sex hormone. This hormones actually plays a vital role in stimulating estrogen releases from ovaries. Gonadotropic hormone control or stimulate the estrogen hormone releases from ovaries. If it does not release estrogen, the menstrual cycle gets disturbed or stops in women, and women may lead to amenorrhea. So first is hormonal changes, where the gonadotropic hormone is a main reason, because gonadotropic hormone stimulate the estrogen hormone, which is releases from ovaries. And if there is, as you know, as I have already explained you, if there is less estrogen, the absorption of the calcium in the body is less, and the person may lead to amenorrhea. Next is intensive exercises. There are maximum chances of amenorrhea in female athlete, especially in long distance runners, swimmers, and gymnasts. In fact, such athletes do intensive exercises or training, which usually leads to decrease the estrogen, which is mainly responsible to regulate the menstrual cycle in female. As a result, a woman's periods may become irregular or stop. Intensive exercise may lead to primary amenorrhea and secondary amenorrhea. So, runner athletes, especially swimmers and long distance runner and gymnast, they may lead to amenorrhea because of intense workout. Next is intake of less calories. If a women athlete take less number of calories in comparison to her requirement, she may suffer from amenorrhea. In fact, intake of insufficient calories can lead to decrease in estrogen hormone, which helps to regulate the menstrual cycle. Consequently, menstruational cycle may become irregular or stopped altogether. So this is all about the causes of the reasons, the factors of amenorrhea. Now, eating disorder. Most of the girls with female athletic threat try to lose their body weight, as a way to improve their performance in the field of games and sports. In order to lose weight, they may practice unhealthy weight control methods, including restricted food intake, self induction vomiting, consumption of appetite super sustains and diet pills, and use of laxatives. Many girls deny their eating disorder due to embarrassment, shame, fear of losing control on the dieting, and mistaken belief that excessive weight loss enhances sports performance. Eating disorder can be fatal. There are following type of eating disorders. First is anorexia nervosa, and second one is bulimia nervosa. Anorexia nervosa is the eating disorder in female athlete. They think only about food, dieting, and body weight all the time. They have distorted body structure. Other individuals usually feel them that they are becoming thin, but they do not believe this. In front of the mirror, they see themselves as obese. So this is, anorexia nervosa means they are thin, they are slim, but whenever they thinks in the front of whenever they stand in front of mirror, they feel like they are overweight, and because of this only they are they are going for dieting, and they are reduce their calories or food. Next is bulimia nervosa. It is also an eating disorder in which a female athlete eats excessive amount of food and then vomits in order not to gain weight. That means they are eating everything, but after some time, after like eating, they will vomit everything because so that they think like they are not taking the calories, they are just taking the taste. In this disorder, an individual being on food and feel a loss of control, then to prevent weight gain tries to vomit the food. They think they are if they vomit everything, they will not get calories in the body, and they may also take a flavor, and they may also eat everything, but this is not correct. Because of this, they are whatever nutrient they have taken, that will also be vomited with this. So there are two types of eating disorder. Both are harmful: anorexia nervosa and bulimia nervosa. So this is all about eating disorders and all. Thank you.